Hello, good evening, everyone.
Good evening, Srishti. Come on.
Yeah, I think we should start by now. So we have close to about 10 members added in this call. So as we all know that we have gathered over here to discuss about organs donation, and on this special day of organ donation day. So we have a couple of people gathered on this platform to discuss about it. Um, Not taking much of the time, I would request to Rajdeep if he can start with the welcome speech in this forum. Yeah, Rajdeep, you're
Sound
on
am I
mute.
audible?
Yeah.
Okay, I got it. Good evening, everyone. My name is Rajdeep Singh, and today I welcome you all in our fourth webinar of Heart Warriors on organ donation and heart transplantation. As we know that 13th of August is observed as a Organ Donation Day to spread the awareness about the importance of organ donation. Approximately 5 lakh people die in 2022 because of non-availability of organs. Anyone can be an organ donor, irrespective of their age, caste, religion, and community. Today, with us, we have a guest of honor, Dr. Julius Punin, who is a senior consultant surgeon in Narayana Health, Bangalore, to interact with us on this topic. He's a, uh, he has an experience of 30 plus of experience. His sport include adult and pediatric cardiac surgery, heart and lung transplantation, hypertension, and heart valve issue banking. I request him to speak few words describing the importance of organ donation and transplantation. Thank you.
Thank you. Thank you very much for allowing me to talk to all of you. So rather than giving a technical talk on how transplants done and all of that, I thought it's best that I do a question answer session with all of you so that I'm sure many people have different questions to ask about organ donation and transplant. So that is the format which I thought we will do. So just to introduce the topic, when I believe most of you are interested in the pediatric heart transplant rather than adult heart transplant. It's quite different from each other. To give a brief on adult heart transplant, most of the heart transplants we do for adults are either result of primary myocardial diseases like cardiomyopathy, or the other commoner thing is to have heart attack related ischemic heart disease. So the major difference between pediatric and adult heart transplants is that the adult heart recipient is structurally normal, even though functionally the heart muscle may not be working very well. Structurally, it's the same as a normal heart. There is no difference structurally. Whereas in pediatrics, most of the congenitally malformed heart are structurally abnormal. And generally, we will be getting only hearts which are structurally normal from the donors. So the donor heart can be uh, tailored in with some modifications to suit almost all congenital anomalies that cause structural differences in the recipient. So I just wanted to show a few slides on the results because that is what most of you are most interested in. So rather than giving the numbers, I thought I'll just show the statistics on the results. Are you able to see my screen?
Yes, yes.
Yes.
So, in pediatric heart transplantation, the survival is much better than adult heart transplants. We know that there is a is the pointer visible? So if you look here, I don't know if you can see my pointer or not, but anyway, if you look at the first portion of the slide, there is a arrow showing the towards a red line, which shows that there is a certain number of deaths that happen soon after transplant, which is about 10% to 15%. So once that part is excluded, as in the second slide, you will expect the long-term survival to be quite good in children. If you see, even at 25 years, there is the blue line is the light blue line is the overall one. So nearly 40% are alive at 25 years, which is not the same in adults. And if you look at the purple line, which indicates the infants, there is a much better survival on the long term for infants. So that is one major difference between adult and pediatric transplants. The survival is a lot better in pediatric age group. When you look at how it has evolved over the years, in the initial year, or when you are looking at infants who are under 1 year, a lot of them form are being transplanted for congenital heart disease, and it was a even higher proportion in the earlier decades because the pediatric cardiac surgery was slightly less developed than what it is today. So 73% of the total pediatric transplants under 1 year were for congenital heart disease in the 1988 to 2003, which fell to 55 now because the pediatric cardiac surgery as a specialty has improved, and you don't need to do that many transplants under 1 year of age. When you look at the next age group, you'll see that the proportion is bit more biased towards cardiomyopathy, which is the disease of the myocardium. And as the next age group comes and the following one comes, always the cardiomyopathy overtakes congenital heart disease by a larger margin. So most of the infants who need transplant will be congenital, and as you get older, mostly it is cardiomyopathy, and only a quarter of them are because of congenital heart disease. And there were some questions regarding dextrocardia. Dextrocardia is a situation where your heart is on the other side of the chest. Instead of facing left, this faces right. Clearly, this one is a PowerPoint inversion, which is very easy to do. But when I just wanted to show you that the heart is facing leftwards here, and there are ways of dealing with that as well. So this one's a real X-ray and a real heart picture. This one's heart is facing to the left. She to the right side. She had come with severe heart failure requiring support with an assist device. So we had an opportunity to look at the heart and make an assessment and compare it with the images, and so we had a clear idea how each structure is. So this is what we do when you have an abnormal heart. We compare all the images and figure out what the anatomy is, make line diagrams which help us, sort of like architectural drawings which help people build things. So we also make a plan as to how to connect what and which way each structure will sit. So if the heart is facing to the right, what we do is we open this side of the chest and make it fall towards the lungs on the left side, and there'll be some space here which we close. So that is how dextrocardia is dealt with. And like this, almost all the different congenital anomalies have a described way of dealing with the transplant. So whatever way the abnormality is, we can do the transplant for them. So what prevents transplant or what makes transplant hard are other things, not the position or the connections. So there was another question about somebody having no pulmonary arteries. So in those situations, we may have to do the lungs also. So what transplant is to be done for a particular individual is something which requires a lot of assessment. And then we plan out how to do and what transplant needs to be done. Okay, what would you like me to do? I have some questions here. Would you like me to go through that, or would you like to ask questions directly?
Sir, I think members would like to ask their
Not
questions.
able to hear you.
Hello.
Yep.
Sir, I think all our members they would like to ask the questions for themselves.
Yeah, please do. So go ahead and ask your questions. I'll try my best to answer them.
Sir, I would like to actually start with a question over here. He's 19,
Okay.
and he is on acetone diet right now. If you look at him, I mean, he is as normal as any other child, living a normal life. I mean, if we look from the like external body picture,
Yes.
but at the same time, being a parent, and of course, from the medical terminology, I'm sure, there are certain things that needs to be taken care of, and we as a parent definitely look after that piece. But at the same time, still we are living in some kind of a fear all the time, considering his health. So uh, I mean, God forbid, though we do not wish that any such situation should arise wherein we would be looking forward to have any kind of like heart transplantation in future. But at the same time, I mean, you being in this fraternity would be knowing it better. Though it depends upon individual anomalies, but what is the possibility, like, I mean, if you can just help me to understand a bit more about it, कि जरूरत पड़ेगी नहीं पड़ेगी, uh, कैसा लाइफ रह सकता है, क्या जरूरत है, I mean, if you can help, being a parent, like if you can help me to understand a bit more about it, and so that I can be more cautious about his health.
So in a patient with tricuspid atresia, one of the ventricles also will not be well developed. That is, the right ventricle is not well developed.
True, हाँ
In,
जी.
in a Fontan circulation, one makes the blood flow go to the lungs without a ventricle, and the systemic blood flow gets the ventricle which is there. And here, the ventricle which you have is of the left ventricular morphology. So that tends to be stronger than the right ventricle. So there are other situations like where the left side is not well developed. The only ventricle which is there is of the right ventricular morphology, which is not as efficient as the left ventricular morphology ventricles over a longer term. And Fontan by itself, Glenn Fontan, which is an earlier stage of which you said you had 3 stages in operation. So these are earlier stages. They're all considered as palliative procedures and not as curative procedures. So having had a Fontan, it is not a cure. It is a kind of palliation, but you get a very good quality of life with that. Fontan has got some problems, but not everybody has those problems.
Okay.
So one set of problems are related to the Fontan circulation itself. Because of the unique nature of its circulation, you get a set of issues related to that, like protein losing enteropathy, liver problems, and plastic bronchitis, things like that. And also, you have the other problem related to the failure of the ventricle. So, you don't have to have a failing ventricle for the Fontan to fail by itself, right? So, if any of these two groups of indications happen, then we consider transplant. And again, I say not everybody will require transplant. Only some patients who are not able to, continue with the Fontan will need transplant.
Okay. And he, while he is growing, so he participates in all the physical activities. I mean, we as a parent also don't feel like stopping him participating in any of the sports activity. So, is it okay if he's participating in like sports like cricket or skating or any other thing? I don't know. Matlab, like I have been hearing a lot from in the recent visit, his cardiologist suggested not to participate much in the physical activities. But is it good? But from his perspective, he's always very much pro into getting into it.
So I do not know if competitive sports would be a good idea, but being physically active is good. And certainly he should not exceed his level of tolerance.
Hmm.
As
Okay.
I said, Fontaine physiology is not normal. So you cannot expect everything to be entirely normal, but you get an excellent quality of life for a long time. Now, it is not like because you participate in physical activity, things go bad. It's because the heart is not good. The ability to participate in these become lower. So that is the way it would be. He should not exceed what he can comfortably do, and with Fontaine, you should get normal saturations or near normal saturations. So
Okay.
if sports is causing the saturation to fall, then it's probably not a good idea.
All right. Okay. Okay. Thank you.
You could,
Thank you.
you could get an idea of that by measuring saturation with physical exertion.
Okay. Thank you. Thank you.
After Srishti, Alok Raj, are you here? Alok Raj or Sarita? If not, then Rohit from Nagpur, are you here?
Yes, ma'am. Good evening, sir. I'm Rohit
Good evening.
Upadhyay.
Good
Sir,
evening.
yes, sir. I have a doubt that my son also has a tricuspid atresia, and he has done the Fontaine already undergone in 2019, sir. Sir, my concern is that what is the procedure in India uh, to register as that my son can need a heart in future. That is it possible that I registered somewhere that my son has the problem of heart disease, and he may need the heart in future? Is there any option available in India, sir, like this? Is there any mechanism in India, sir, like this?
That is not how it works anywhere, because at the moment he is not a transplant candidate because he's well.
Yes, sir.
So there is no way you can register him as a transplant candidate anywhere in the world.
Okay, sir.
Not in India, not anywhere else.
Okay,
A,
sir.
a cardiologist or a surgeon who is involved in transplant should decide that this particular patient requires a transplant, and then the process of registration starts.
Okay, sir. Okay,
So
sir.
it is not like you can register early and therefore you'll get. See, the heart is not like kidney. There is not a very large waiting list anywhere in India.
Yes, sir. Okay, so thank you, sir. Sir,
Right.
one more question I have, sir. That sir, the tricuspid atria has all some different surgeon do some different type of Fontaine surgeries. So, is there any issues in transplanting of heart in future for some cases?
No, whichever way it's done, we can transplant.
Thank you, sir. Thank you, sir.
Devnita, are you here? Devnita. Then Antalika. Hi, Antalika. Antalika.
Um, I have one more question over here.
Sure.
May I? Yeah. So, sir, while we all know that heart transplant cost is very high, this is what kind of perception that we have been receiving from different forums. So, is there any like platform available apart from Mediclaim, wherein we can get the, especially the corporate Mediclaim that we work in, like the organization, any platform available where we can get some kind of a financial support? I mean, I really don't know if this question falls in your particular forum or not, but being a part of that fraternity, I mean, if you can advise something around this.
What is your imagination as to what the cost of heart transplant is? What do you think is the cost of heart transplant.
So what I've heard is close to about 20 or 25 lakhs in the current scenario.
Right. It varies between hospitals. We charge 15 lakhs in our hospital, but
Okay.
there are other places which charge more. There may be places which charge less, particularly government institutions. And some states, particularly southern states, and I know Assam, do support patients on based on some criteria or the other. It may be your residence geographically, or it may be some financial criteria. So in Karnataka, we do have a scheme which supports people who are below poverty line, and they take care of the entire expense. The government takes care of the entire expense. But for people who are not below poverty line, there is no government support available. There is no specific NGO as such, but there are some people who run NGOs which supply medications to transplant patients. Tamil Nadu government tends to supply medications to all transplant patients. So I don't know if there's a financial criteria there or not. So it varies between states and varies between hospitals in the expenses. But what you really have to understand is it's going to be not just the transplant cost. It is going to be immunosuppression, which can be about 15 to 20,000 a month after the transplant for lifelong. And when you have complications following transplant, those tend to be quite expensive to treat. Particularly if you have antibody-mediated rejection or some strange fungal infections, all those medications become quite expensive. So if you look at the lifetime cost involved in a post-transplant scenario, it can be quite high. So even if somebody offers a free transplant, you still have to deal with the subsequent costs. I think you're on mute.
Okay, yeah, because I come from the northern part of India actually. So while I understand the recurring cost, I mean that's something which still, I mean, to a certain extent, of course, manageable. But at the same time, that one-time cost is quite huge, and whatever I've understood from the northern side, uh, I doubt if any support from the government is provided, because I reached out to the NGOs also, but I think there the climate is quite different when it comes to getting a support from them as well.
We have also seen a lot of crowdfunding happening for children for transplant. Uh, so there are organizations which spearhead this effort, and they work on a commission, and they tend to raise funds fairly well professionally.
Okay, thank you, sir. Thank you.
Rastip,
He- Hello, good evening, sir.
Good evening.
Hello. Yes, my
Hi.
name Heru from Indonesia. I'm the parent and uh, the parent of CST Kid and activist for CST Kids in Indonesia also. May I ask some question for you, sir?
Sure.
Who are the candidates for heart transplant, and how if someday I will refer a patient to your hospital maybe? Can you do a heart transplant for Indonesian patient?
So the Indian law gives us some limitations to that in terms of allocation of the organ. The organ allocation to foreign nationals can be done only when the whole country doesn't want that organ for one reason or the other. Even then, sometimes you do get foreign nationals getting transplants here without much of a problem, because many hearts are wasted without being transplanted at all. So the waiting list may be longer, but it is possible that you may get a transplant.
Mm, okay, I understand. And what the candidates for the best candidates for heart transplant, sir? Maybe like a patient who cannot get conservation surgery or something else, maybe.
Yeah, it's usually people who cannot have non-transplant corrections. So if you look at some diseases, there is no reasonable non-transplant option. So that is one. And the other thing is when there is a problem with the ventricular musculature itself called cardiomyopathy, which may be sometimes drug-induced for chemotherapy like adriamycin or something, or it can be without any particular reason. And
Mm,
sometimes post-surgical correction, if you've not been able to get the desired effect with the surgical correction, you may still need to have a transplant. Or later on when the ventricular function fails, or the particular physiology we expect to work well doesn't work just as well.
okay,
Just to
okay. Thank
speak broadly.
Okay, thank you, sir. I have seen your profile at Google. Are you work at Bangalore? Yes. Sorry. I have seen your profile, sir. You have sorry. Are you work at Narayana Hospital at
Which hospital?
Bangalore? Narayana.
Yeah, that's where I work.
Okay. Is Narayana can do heart and lung transplant
Yeah.
for pediatric
We
patients?
have not done any pediatric heart and lung transplants yet, because
Mhm.
getting a pediatric heart and lung transplant donor may be quite difficult. So, if it's reasonably, because the lung size would limit it. In heart, we can usually put a much larger heart in a child, but lung size would be a limiting factor. So the donor availability, particularly if you're a foreign national, may not be very easy. But then I cannot tell. It depends on your luck, because there may not be many takers for that group also.
Hmm. Okay. Thank you very much, sir.
Welcome.
Next, Rajdeep.
Hello, sir. My question is: can a CHD adult can have a heart transplant?
Yes. See, it is not always children who require transplant. As you know, some of the adults, like particularly if you look at diseases like congenitally corrected transposition, they tend to have heart failure in the third or fourth decade of life. So, that's the time they need transplant. So also when some repairs fail much later in life, that is another instance. And the other situation is when the pulmonary hypertension develops with uncorrected CHD, they also require transplant of either the lungs or heart and lungs as a block in adult life.
Okay, sir. Thank you, sir. One more question. Then how much time is required to recover after a heart transplant? How much time does the patient stay in hospital?
Yeah, in a week's time, they'll be up and about, usually in the absence of complications. But they probably stay in the hospital for 3 weeks to 4 weeks. And it'll probably be about 3 months before they're back to normal activity.
Thank you, sir.
Antalika, are you here? Antalika, I can see your name. Antalika. Anybody else? Yeah, Appu.
Sir, I'm a dextrocardian also with
Right.
spontan circulation. Is what is the percentage of getting a dextro heart in India?
I've never seen one. I've never heard of a donation of a dextrocardia heart. But if you're looking at doing a transplant, we don't really want a dextrocardia heart. When we get a normal heart, we can transplant that in dextrocardia recipients. So there are several described techniques how to deal with it. So that's not a major issue.
So when you put that heart, will you put it in the normal side or in the, like in the dextro?
No, we'll put it in the normal side. See, there are different techniques, but normally we put it in the normal side. Otherwise, it'll be like a big jigsaw puzzle.
Sindhu, you want to ask something?
Yeah. Hi, I'm Sindhu.
Hello, Sindhu.
My daughter is she's like Russia. She's 4 years old. Just wanted to know that, like as you told, heart transplant in children is more successful, but we don't have much donors.
Now, it doesn't. We don't know if your child will need a heart transplant at all. It is not like tricuspid atresia is treated with heart transplant as the first choice.
Yeah.
That is not the first choice. So you should try and get towards the Fontaine pathway if possible. And when that doesn't work for one reason or the other, either from the ventricular failure or one of the Fontaine physiology failure, then we look at transplant.
Okay. So, sir, for a child, at what age will the adult heart suits? Like in the teenager, or what is the age?
In teenager, it's not a problem, but we have put adult hearts in much younger children also.
Okay. Okay, thank you, sir.
Welcome.
Devnita, are you here? Devnita? Then Rajiv from Kolkata. Then Antalika. Actually, they shared their questions, but I don't know why they are not responding now.
I mean, if you can tell me what the questions are, I can look at it. And I have the questions here. So let me just look at the questions, see some of them which I haven't addressed so far. Is the transplant dependent on other people's donated heart? Yes, we can. That is the only way we can do a heart transplant. Cost we've addressed. And how close to normal life can one get after transplant? Very close to normal life. People can get back to work, get back to normal activity. The only restriction is you have to live in a clean environment and be vigilant about not getting infections, and follow medications very religiously. Dextrocardia I've answered. Life expectancy I've shown that slides. Adult congenital. After the death of a person, how much time the heart needs to be retrieved to be viable? So we have to take the heart out when it is still beating, not after the heart is stopped. So it is not after circulatory death, it is after brain death when the heart and lungs and all are supported and kept working. And which organs are useful from a diabetic donor? Diabetes in the initial stages doesn't affect many organs, but as you get to be a diabetic for many years, it starts affecting the kidneys and other organs as well. So long-term diabetes may not be a good idea to retrieve organs from, but if you each organ needs to be assessed in its own merit and then decided. Why people die some years after getting a new heart? That is because all hearts will develop some form of rejection, and they develop coronary artery disease over a long period of time. That happens sometime in 5 years, sometimes in 40 years. We do not know which persons are going to get earlier chronic rejection or later one. So some people tend to live for a long time, some people don't. So we go by what is called as median survival, which is when half the people are still alive. In the case of adult heart transplant, it is about 13 and a half years. So 50% of the people after a heart transplant are still alive at 13 and a half years. That is what is meant by the median survival. And somebody had asked about heart, lung, and liver. I do not know of any heart, lung, liver having been done in the country, but it's possible. But if it's a child, it is very unlikely that you will get a donor easily. You may have a very long wait time. And dextrocardia I've answered. And somebody had said, do you have to be in a clean environment? Yes, dust, insect, rats, etc. It is not a good idea to be living in environments like that after heart transplant. Ticks on rats or dogs, or you shouldn't even have a pet at home if you had a heart transplant. So insects can cause serious problems by bites transmitting infections. And clearly, a place where there is a lot of dust and rats also tells you that the environment in that place is not conducive to a patient with any transplant, not just heart. So I think these are the, and something about artificial heart. Artificial heart, so there are a few different types of artificial heart. One is called the total artificial heart that costs about 2 crores in all to implant that. That is usually used as a bridge to transplant, not as a destination therapy. So it is not meant for someone to survive with that for 20 years. It is meant for 1 or 2 years waiting for a transplant. And then you have to have a transplant after that. Artificial heart does not require immunosuppression, but it requires anticoagulation. And certainly there are mechanical issues with all these artificial organs. LVAD supports only one side of the heart, which is usually the left ventricle. And it is not a great option to use an LVAD in a single ventricle situation, though people have used temporarily, but they generally we don't know enough to deploy LVADs in single ventricle situations, though some LVADs are, it's possible to use them. I think that sort of covers the questions which have been sent to me, besides what I've already spoken to you. Anything else anyone wants to ask?
I think these were the questions. Those were shared by all the members.
Right.
So anybody else, if you want to ask? Hari, you are here. You have some question?
Yeah, ma'am, I'm here. No. I was just hearing. Sir, I've already answered all the questions.
Okay. Sajni?
No, I was also listening to what doctor was saying. Like he has covered almost all the topics of concern. Thank you so much, doctor.
Welcome.
Yeah. Just last one question. So the heart transplant, minimum around 15 lakhs. I mean, does insurance companies support this? Insurance companies?
I do not know the answer to that, to be honest. It depends on the kind of insurance you have, is what I would guess.
Corporate, like can corporate insurance?
That is probably the best bet, because pre-existing illness is an exclusion criteria in all the other insurances. In corporate, that is usually not a problem.
Okay. And so you do, like after surgery, the like the cost of living, like I mean, it will increase for a heart surgeon, like 20,000 per month. It's like totally the hospital, like it will be always there, or it might be there.
Yeah, after the first year, it tends to get a little better, but it's probably going to remain around 10 to 12,000.
Okay. Okay, so it is like medicine charges, or how?
Yeah, the medicines are expensive, and you will have some complication or the other as you go on.
Okay.
Treatment of complications are also quite expensive.
Okay, got it. Yeah. Thank
So
you.
one other thing is, not everyone is happy to do pediatric heart transplant, particularly in morphologically abnormal ones. So if you consider heart transplant for a child whose heart is abnormal, you should choose a place where there is a lot of pediatric cardiac surgery happening. At least there will be some familiarity with that for the team. It's not just the transplant surgeon, The
Mhm.
transplant team is very, very large, and you need various levels of expertise to look after these children. So the intensive care is important, pediatric cardiologist is important, and the surgeon is also should be familiar with the with pediatric surgery as such, and transplants.
Okay. Okay. Yeah. Thank you.
Welcome.
Sir, one more question I want to ask you, sir.
Sure.
Sir, in India, sir, if suppose, sir, if I donate my heart to in Maharashtra, sir, or in any city, sir, in India, sir, and if someone needed in the other state, so that, sir, India, is there any mechanism that in which the heart or any organ can be that any doctor in India can see that here is the heart is available or here is the liver is available for transplantation, sir?
Yeah, it is possible because the overall coordination is done by the National Organ Transplant NOTO organization, so Organ and Tissue Transplant Organization. They what happens is when the state organization puts out a notice to the national organization, they inform everybody. And if somebody is willing to take it from another city, then obviously somebody has to pay for the cost, which usually is the donor, is the recipient. So if the recipient is willing to pay the cost of air transport, many people will be able to do that. Sometimes we've been able to transport hearts from long distances in commercial aircrafts also, which obviously doesn't add to the cost very much. But we have
So,
a time limit of 4 hours.
okay.
You take the organ out till you re-establish circulation.
Sir, for normal citizen, we cannot see what is the rush in any for any recipient of any organ. I cannot see the list that these are the people listed for the heart transplant in India, and these are the donors which are available. I cannot see it, na, sir.
No, because the donor will be listed once he's brain dead. And we don't know where somebody is going to be brain dead. The number of road traffic accidents in India in a year is 140,000. So good number of them die of brain injury. So there are a lot of potential donors around, but then awareness, family willingness, religious obstacles, sometimes just convenience. They want to do the funeral at a particular time. Organ transplant is going to delay that a little bit. Issues like that, and sometimes just nobody may have told them that it can be done. They may not have thought about it. When someone is dead in the family, that's not the first thing that comes to one's mind. There are a lot of other issues. So there are many factors why transplants are not happening as much as it should have been. And also, it is not like there are not enough people in the country who require transplants. But if you look at any hospital, the number of people on their waiting list is very low. I don't think we have more than 3-4 people waiting for a heart. So that is also the other thing. Many pediatricians do not refer for transplants, thinking the transplant results are poor. So that is something which is going to change over a period of time. We are still in a kind of early phase of transplant. Even though we started in '94, at that time you were doing one transplant a year or 2 transplants a year, but that is not a program. That is like an occasional case. Now many places have got regular transplants. So 5-10 years of that sort of numbers will make awareness much better, and then the whole thing will get a momentum.
Thank you, sir. One more question I want to ask you, sir. That if anyone want to donate any organ, what is the best procedure for that, sir? Because if there are a lot of hospitals which can accept you, which can fill, which will agree to fill the forms and all that, doing all the formalities. But what is the correct procedure in India to for giving the for giving the my concern that if anything happened to me and my brain get dead anytime, I want to donate any of my organ.
So the best procedure is to tell your family that your wish is this. So even if you haven't filled any form anywhere, if your family comes forth to say to tell the hospital that we want to donate the organ, that is sufficient. The fact that you filled a form just sort of shows your willingness to do so. Once you are dead, you're not a legal entity. So that form is not something which which authorizes somebody to retrieve organs. It has to be done with the consent of the family, next of kin, whoever is in the legal possession of the body. So what is most important is to tell your wishes to your family so that the surviving family members know that this is what you want, and they can contact the hospital and do that. You can register yourself as a donor on the Noto site or wherever else you want, but this is more important than that.
Thank you, sir. Thank you, sir.
I think Mr. Amod has joined. Do you have some question?
Hello.
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 Yeah, I can
Am I
hear you.
audible?
Yes, yes.
Hello, sir. Good evening, sir.
Good evening.
Sir, this is A.K. Kushwaha, and I have a 7-year-old son who is having complex congenital heart disease.
Right.
And actually, he is having three-chambered heart. And I wanted to know, is there any research now going on whether the stem cell therapy can be used to regenerate that lost part or undeveloped part, or to repair that undeveloped part of the heart?
It is not possible today. I do not know what will be there tomorrow. But in my thought process, is very unlikely you will develop a new chamber with stem cell therapy.
Okay, thank you.
Anyone else? Otherwise, we can conclude this session here, the question answer session.
So do you have any questions yourself?
Is it?
Do you have any questions yourself?
So those were in the list you have answered.
All right.
And now I would like to call Appu for vote of thanks.
Hello, sir. Good evening to everyone. I feel honored to propose this vote of thanks today. With God's grace, we are all happy and grateful for the success of our fourth webinar. Respected Dr. Julius Punin, sir, first of all, I express my deep sense of appreciation to you for gracing today's webinar and for enlightening us with the answers to our questions. Respected dear doctors, I would like to thank each one of you who joined this webinar and for supporting us in our journey. Next, I would like to thank all our well-wishers who joined this webinar, especially the members from Little Heart Foundation of Indonesia and Dextrocardia Group of India. Like India's unity in diversity, active participation of our members from all around India is our success. So I take this opportunity to thank all our members who support us with their valuable time and thoughts for their questions and the queries they shared with us. Finally, I thank one and all who are present here. Thank you, sir.
Thank you.
Thank
I
you,
hope I've
Appu.
been able to answer all your questions to your
Yes, sir.
satisfaction.
Yes, sir. It was up to our satisfaction. And I think we can conclude the webinar now. So after this webinar, if anyone comes forward as an organ donor, so I think our session will be considered as a successful one. And although we are all of us are mostly potential recipient, so I think questions were regarding that part only. So thank you, sir. Thank you, everyone.
Excuse me, sir, I have one word. How can you support us in this group? As a doctor, how can you support us, our group?
The way I can support you is to answer all your questions whenever you have one. Because not many of you will need transplant.
Yeah.
Hopefully nobody will, but some people will need it. And I want you also to know that regardless of how complex the anatomy is, we can do a transplant. So it doesn't matter how many lines are there in your diagnosis, and how your heart is situated, how complex it is connected. All that we can take care of. So a lot of people are not aware. They think that because the donor heart is normal, we cannot use it in a dextrocardia, for example. That is not correct. We can do heart lung also when everything is abnormal. It is usually not that which limits transplant. So you can inform other people also that it's possible.
So in that case, I have one question. Recently, one patient who died within this week. He was thinking of going for heart transplant on last Friday, and then suddenly he was admitted in Kolkata, and then after admission,
he was not for heart transplant. His problem was he had pulmonary hypertension, which is a different problem. He requires primarily the lungs to be addressed. So as a child, it is difficult to do lung transplant. So we had done a palliative procedure on him, which sometimes children do very well with that. And his problem was not related to that. He had another diagnosis which eventually caused the death. It was not because of his lung failure or heart failure. It was something else which took his life.
okay, I thought it was he was waiting for heart transplant, and then because her heart and lung were in a very critical situation, so it could not be donated or transplanted. I thought in that way. Okay, thank you. So I think we can conclude the session here.
Sure.
Thank you.
Bye.
All that.
Thank you.